My mom was a big inspiration to me. She became a nurse later in life, and I remember her working nights and going to school. For most of her career, she was a school nurse. I would see the kids come in there and her take their temperature and seeing the smiles on those children's faces. I was like, I want to do something like that.
There is a lot of nursing in my family. My mom is a nurse. My brother is a nurse. And then also, my great-grandmother was a nurse too, but I'm sure nursing school was really different then than it is now. So healthcare was always where I saw myself.
My biggest thing is my kiddo, Drew. He is the reason that I continue with my studies, continue working. Every semester I complete is another semester closer to being able to have that much more time with him. And it's kind of showing him that you can always be working towards something better. You can always be improving yourself.
So this is my grandmother. She's my main reason why I wanted to become the nurse. I actually have a bachelor's in architectural engineering. In my first semester, my grandmother, she ended up having a stroke. The nurses there, despite not being able to understand her or anything, they were very, very helpful in trying to make sure that all of her needs were met. If I'm able to help patients like those nurses helped my grandmother, I felt like I'd be making more of an impact than I would as an engineer.
I found a picture in my parents' house. It was, one of those books that you make in elementary school. And I saw I'd written in there, I want to be a kid's nurse, spelled N-U-R-S. And I just realized that 8-year-old me was right. That's where I needed to go.
Originally, I thought my dream job would be in the OR. And then when I had my first clinical at Saints here in their ICU, it was nonstop. And I liked that pace. It was like controlled chaos, and I was like, I like this.
I've been at St. Anthony for 18 years. I've been in behavioral health the whole time I've been a nurse. I can honestly say there has not been a time where I wake up and feel like I don't want to go to work. When you see these kids, they come in troubled, but to see them interact and to see them smile, I feel like I am making an impact in these children's lives. I want to go further. I enjoy learning. I enjoy teaching people. There are things that I can't do as an LPN that I want to do for the hospital.
I started working as a CNA and fell in love with just the caring of people. So that really developed my passion, just seeing what I could do for somebody. And then once I got my paramedic, I wanted to do more, care more for people, and actually see how our interventions help long term.
I love helping people. I love making them laugh and smile. And that's one thing that I've really noticed with my patients is that I'm really good at lightening the mood in a room.
People just really want understanding, compassion. I don't know their backstory, but I know that I've been called there to help them at that moment.
Sometimes there aren't words that are going to help them with what they're going through. So sometimes just being a smiling face or being there and holding their hand.
There's no question that St. Anthony has a tremendous commitment to their employees. And the Reach for the Stars program is just one of many examples of the way that we care for our employees and we want to see people succeed.
I've been working for Saints for about 2.5 years. I knew that I wanted to go back to school. When I found out about the scholarship, I thought that might be a good option for me.
The Reach for the Stars scholarship provides opportunity. It opens up doors for people that have always had a dream of being an RN, but they just couldn't afford it. Well, SSM's given them that opportunity.
Nursing school itself is hard. Even if you have the money and time for it, it's still hard. And with the scholarship, it's made this entire experience so much easier now that I don't have to worry about the financial burden that it would have placed on me and my parents.
I am very, very thankful for this, not having to worry about that as I go through school.
I've worked at several other facilities as well, but I've truly found a home at St. Anthony. They've really put money and time and effort and manpower into improving their workforce, improving their staff, and it really shows.
It really is special here. People genuinely care about one another, they care about their teams, and so it makes providing this scholarship to SSM employees even that much more special, because at the foundation of who they are, they genuinely care about those who come into our doors to seek care.
I have had a really good time with St. Anthony's. I want to be the best nurse that I can be.
Here I am, going to nursing school final year and hopefully getting my RN, and I'm helping out my hospital. The hospital's helping out me. I get to stay with the hospital that I really, really like.
My son, we were sitting over here, and he looked over and was like, "Dad, I'm really proud of you." That has been a really big motivator through everything.
My mom would be really proud of me right now. I hear her voice. She was always like, "Annie, you need to go back to school." And here I am. I'm doing it.